I would like to mention the topic about the patient's access to melanoma drugs and to cancer drugs in general, but I pretty much liked the session of this morning that mentioned this topic. I just wanted to point out that actually the costs associated with cancer treatment have increased really in the last 5 years. If we look at the data that was presented, we can actually see that in US, in the last 5 years, the cancer costs or the cancer associated with costs, the cost associated with cancer treatment increased for about 70% in the last 5 years, and outside US about 50%. And the difference, if we look into the last 2 years, so between 3 years, between 2014 and 15, it's around a difference around 12%, so just in 1 year. Actually, there are a lot of new drugs that are available. So around 50 new drugs were available in between 2011 and 15. But these drugs are not universally available for all the patients. So we look at the data or what was presented today, and actually only 6 countries were, in 6 countries was possible to use half of these 49 drugs that were available in the last years. And this is an issue because we have the therapies, but the patients do not get it. Of course, the patient's access depends on several aspects. It depends on how long it takes to have the access, on the budget that is available for these therapies, and also on the availability of cancer care. This is at least one of the 3 aspects that that should be considered when considering patients' access to cancer care. There are a lot of tools that can be used to access this clinical benefit. Actually, there are also the possibility to access by using multi-center analysis or multi-country analysis. One of the analyses that was presented today was one conducted or supported by EADO that included a survey using or conducted in 34 countries. The first survey was published in 2016, and this is kind of an update of this survey. And actually what we see is that there is a very different access and very asymmetric access to these drugs in these countries that participated. The estimate number of patients that will not have access whatsoever to melanoma cancers, cancer therapies, it's around 14,000 patients that do not have access to these kind of drugs. And if we look into the European setting, between 2016 and 2018, the difference is between 5,200 to 4,800. So there is not a very big difference. And actually in some countries from Latin America and the US, you only have access to these therapies if you have a private health insurance. If not, you do not have access to that. Coming back to your question about the tools, there are different tools that can be used. One that was mentioned today in the morning was the ESMO magnitude clinical benefit scale, that actually assesses or tries to assess the clinical benefit of a drug. Of course, this is something that needs to be considered not just globally, but locally. And one of the aspects that actually needs to be seriously considered is the clinical value of a different therapy based on the country that is going to be applied. So we need to look at the clinical value of the drug and assess that based using one of these tools, using also the frequency of the disease and the setting where this drug is going to be applied, but also somehow translating this information to the local country or the region. And this can be done or should be done using the GDP and also the percentage of the GDP that is applicable or applicated to the healthcare expenses, so to say. So we need to come up with a strategy that it's global, of course, but it is also local, and it's somehow geographically adapted to this problem, that it's a local problem and a country problem. But it is also cross-border problem, so we cannot just refer to this to a problem that is in one country or just in Europe. It's across Europe, and we need to come up with a solution that is universal or somehow tends to be universal and tends to benefit all our citizens, as was mentioned today in the session. That is an amazing aspect that needs to be actually pointed out. Patients' advocacy, it's increasing, or their importance and their activity and their work, it's increasing in the last years, so to say, and actually we have a lot to learn with them. They are actually doing a pretty good job trying to bring up the patient's needs to this discussion, and we need actually to listen to them as well, and not, of course, there are other stakeholders that need to be taken in consideration in this discussion, but patients should be the center or are the center of our work, and we should listen to the patient's advocacy issues and what do they have to tell us, because as was, I really like this aspect that was said, that was mentioned today in the morning, that we should not look into win small battles, because it's important, but we should win the war. So it should not come up with point solutions, but with a global solution that somehow benefits all the citizens that are in need for these drugs, not just for melanoma, but for other patients, for other cancers as well. So actually this article mentions that this is a problem for all skin cancers, and actually it's just not a melanoma problem or a problem with the melanoma patients, but actually with the non-melanoma skin cancers, namely basal BCC, so basal cell carcinoma. We also see these differences across countries and the access to these therapies across countries. So of course, it was meant to be related to melanoma, but we can see also these differences in other skin cancers.